And we are live. Bonjour, this is Bruno LARVOL, and this is our weekly podcast. We call it Build in Public because we are sharing with you how we're building our cancer data platform, CLIN, LARVOL CLIN. And we share with you our successes, sometimes our challenges. I'm here today with Daniel Yaramillo, one of our product manager at LARVOL. Bonjour, Daniel.
Hello.
We're going to talk here about the work that Daniel is doing, and then we're going to focus on one use case of CLIN, which is preparing for uh, medical conferences, oncology conferences, in particular, the upcoming ASCO GI conference that is taking place in San Francisco. And Daniel and I will be there in person. So we're going to give you a preview of how you can use CLIN before, during, and after the ASCO GI conference. And as you listen to this podcast, by the way, which is live, feel free to leave a message for us, and we'll be able to give you a sample of what CLIN is and a credential to test the platform as well. So first, let me tell you about CLIN. CLIN is essentially Wikipedia slash Bloomberg for cancer data, but not any cancer data, specifically clinical trial cancer data, publicly known trials, publicly known data. Excuse me. So our job is to collect all of the data available of the outcome of clinical trials and to make them available for you. And Daniel is working on a very important part of CLIN, and he's going to give you now a bit of an outline of what he's doing, and then we shift to ASCO GI.
Right, so I work on key population, the key population tab on CLIN. It's still on beta, but it's quite exciting because what we do there is we try and have define and tag everything on our databases with one key identifier, which is the population, right? So our population identifier is kind of like a Pantone number for cancer. So in there we have the tumor type, we've got the biomarker, stage, LOT, prior LOT, and any other modifiers that might need to be included into that population. And then we curate all the data by population. So in a sense, if you're a clinician or if you're doing trial design or any sort of research on a specific population group or a specific type of subgroup of a cancer, you can go in there and find everything a lot more easily than you would if you were just searching individually on all of our tabs. So as of now, we have managed to compile third-party landscapes. So we have a number of third-party landscapes from things we find on X, things we find published on ASCO, ESMO, or other conferences. We also have all the trials that are related to that specific key population. We have a number of treatment algorithms that either NCCN or other entities will publish. We have Twitter polls, which is quite exciting because we managed to capture everything that comes out on Twitter and tag it to a specific population group. So if a KOL or somebody else publishes a poll that says, hey, what would you do to treat a patient that has this and so, and there's 3 or 4 options, we capture that. And we also capture all of the regimens that are recommended by different partners. So anything that has approval by the FDA, NCCN, all of that. So it's quite exciting to be able to participate in it and connect all of those data points.
Daniel, before we shift to ASCO GI, do you mind sharing your screen and showing us even the key population tab that you're working on with your team? And I like the image that you came up with, which is a Pantone number. So essentially, the world of cancer is divided by Pantone number. Some are broad, some are narrow. And a Pantone number is a key population in cancer. And for each of the, I like also the image of a Google map,
so,
essentially.
I'm going to leave and rejoin for 1 second so I can properly share my screen, but you can
Sure.
keep the audience entertained.
Yes. Of course, I'll do my best. And Actually, I'm going to say something in the meantime about ASCO GI. So first, if you're listening and you're going to be next week in San Francisco, which is where I'm located for ASCO GI, please let us know. We would love to say hello at the conference. And we would love also to share with you how this product can help you prepare for ASCO GI and gather the data from ASCO GI. Daniel, can you hear me?
Yes, and we
Okay.
are ready to go over here.
All right. Right. Let's share your screen.
Can you see my screen right now?
It's probably going to come in any second now. And if here we are. Okay.
All right. So I'll give you a quick walkthrough of key population first. Let's take, so this is being constantly updated. So chances are, if you're seeing this now, in 2 to 3 weeks time, the whole logic of search might change, because that's something we have on the pipeline. We want to change this because right now you're searching by tumor type, but we want to change it so you can search by specific KPD. So let's say that we're looking at HCC, right? So you can search for HCC, select HCC, and we're going to give you a list of populations that are on our database that we have records for that we can show you. So let's go, for example, first line HCC, and you'll find a number of tabs. Now, the number of tabs depends on the population. We are moving towards having only results for selected populations that have more complete results. So they'll have landscapes and meta-analysis, trials, polls, regimens, and algos. But as it stands right now, if you go into the platform, you might find 1, 2, or 5 different tabs, depending on the population group. But for first line HCC, it's a pretty complete one. So we've got a number of landscapes on here. So we've got some from Apex Onco. You can click on it. It's a little preview of the image. Now, if you click on the source, it'll take you to the source. You have the linked trials for anything that is shown on the landscape. You can also navigate the images here. So if you want to switch through and kind of browse through all the landscapes for that specific population, it's very helpful if you're trying to maybe grab a quick look or glance at what is being looked at, what are the main trials, or the main products that are being mentioned over here. We also have all related trials to that population. So as is usual for CLIN, so we have the same UI as in our trials tab with all the same information. These are all the trials linked by most mentioned to least mentioned on our landscapes for this specific population. So I Am Brave is the most important one, Himalaya, LEAP, so on and so forth. And you have all the information for that specific trial. So if you click on the trial, it'll take you to the Trial 360 page. You can see all the information moving back to the first publications of this trial when it was a poster in ASCO, all the way to CLIN cancer res. We even have some FDA references for this one, quite complete. For polls, you have this very nice clean UI, so you can see who posted it. You can go to their profile. This will take you to the tweet in particular that this was at. The text and then the results, right? So what was the final result for this? What was the final result for this? Quite helpful if you're trying to get some sentiment analysis of who said what and what do their followers or what do other oncologists or the public that follows this person thinks about whatever it is that they needed to answer. And then for regimens, this is, I think, our most quickly expanding tab. We have a list of regimens that NCCN has recommended for this particular population with their level of recommendation on the side. So if you click on it, you can see the exact verbatim by which this was recommended for this particular population. Very useful, as well as the trial that is linked to it. And moving forward, you'll be able to see also approvals for this. So if any of these regimens were approved by the FDA, you will be able to see a little approval, and you'll see the approval verbatim for it as well. Or if we have the same regimen approved for maybe what we call a subpopulation or a downstream population, right? So if we had first-line hepatocellular cancer with some mutation, that would be under the same regimen. So if this regimen was approved for also a different type of mutation, you'll be able to see the approval for that or the recommendation of the guideline for it as well down here. So it's quite complete, and it gives you a very nice way to search for records by population.
Thank you, Daniel, for that introduction. We're now going to shift to ASCO GI in a week. You and I will be there. So let me say an introduction, and as we speak, you can start sharing maybe a couple of slides from our platform. So what we do for conferences is that we extract all of the abstracts ahead of the conference. We link these abstracts to their clinical trials information. And then we have a panel of 5,000 oncologists on X, on Twitter. And each time they mention or discuss or make a commentary on that data disclosure expected at ASCO GI, it's automatically indexed, and the sentiment of that post is actually extracted. So even ahead of the conference, and that would become clear a day or so before the conference, we're starting to have a very clear picture of what people anticipate are going to be the most interesting, exciting data disclosure at ASCO GI. So you can see on this this picture here, there's not a lot of data yet, but in the next few days, we'll see more and more data percolating into the system. And then, I mean, obviously, there's the ability to drill down and to see the actual tweets behind each disclosure and the conversation among opinion leaders on X. One comment I want to make about the approach we have is that we do something that initially I thought would not work, which is we're using AI to extract the sentiment of these tweets. Initially, I thought, no, you need an analyst to do that. The language of science is too finicky. And then I realized I was wrong. AI does, I'm afraid to admit, a better job sometimes than an analyst, certainly being consistent in the way it extracts sentiment. It has no problem figuring out that a tweet that says no MRD, MRD, of course, stands for minimal residual disease, no MRD, he has no problem calling it a positive tweet. So one of our interests, it's a feature that only us have, by the way, is to extract the color, the commentary on the conversation on the data at all of these cancer conferences. The sentiment that we're extracting is soon going to be more complex. In addition to extracting negative data, that's easy. Neutral data, it's a mixed bag. Positive data, we're also extracting practice informing and practice changing, meaning that not only it met primary endpoint, that'll be positive, but it met it in such a way and for such a population that people expect that data to change clinical trial, to change the practice of medicine more precisely in a particular population, or to end up in the NCCN guideline as a preferred regimen, which would be practice changing. We also, and then I'll let you add your own color to what I'm saying, Danielle. We also extract with AI the reason for which a tweet, a post is negative. Is it for no reason, right? Or is it because there's toxicity that is discussed? Is it because of reimbursement or the cost of the medicine? Or is it because the trial design has certain flaw that the experts on X are commenting on as part of their critical commentary? So that's our platform to analyze with, again, that virtual panel of oncologist expert to analyze the data that is going to be disclosed at ASCO GI, to look at it before the conference, day to day as the data arrive, and at the end of the conference. I give you back the microphone for maybe a couple of additional comments, and I'll let you have the last word and close. We have about a minute left, and close this week's episode of Building Public for LARVOL CLIN.
Sure. So, I mean, for everybody that's seeing this right now, of course, we have a lot of information for it because we can extract a lot of it from the trials that we presented at the conference. But if you loop back maybe the 22nd after the data has been published, the 21st, so we're going to start getting some results out there. We're going to start getting some more tweets and opinions. This is updated as close to live as we can. So it gives you a great idea if you can't make it to the conference, or if you all could make it to the conference and don't know what sessions to attend, kind of what's popping, what's going to be good, what's going to be bad, and what's going to have a little bit more impact on your practice or medicine or the industry in general. So it's quite fun to see it, especially during the conference, to check it out and see how everything is changing, how the data is changing. In some cases, maybe the trial presented and the results were not as expected, and you can really see that on the platform. So really excited for what we can do, and hopefully we can help a lot of people do it. I'm going to stop sharing so I can come in and just send a little message to our producer that we can stop live in like 30 seconds or so.
Thank you very much. And I wish everybody a good weekend, and we're looking forward